Hello my dear students, good evening to every one of you. So how is your weekend going? How is your studies going? I hope you all are having good time. I hope you all are studying very good. So this is Dr. Anisha from Sri Chaitanya Educational Institutions. Welcome you all for our another session of Bridge Course NEET 2025 for the aspirants of NEET 2027. Good evening, good evening, good evening to every one of you. Yes, Alia, good evening. So what we are going to study here today? We have studied till now a lot of chapters which will be beneficial for you all when you are starting your actual classes. But today we are going to study one more very important topic, that is our human health and what are the diseases. So about the health and diseases we are going to study again. Alright. So, come on guys, have your pen and paper ready. We'll start another session of our studies today. We'll start another session of zoology lectures today, which is filling the gap of between the 10th and 11th standard. So, let's start studying here. So, what is it all about the studies today? So, what we are studying today? It is going to be the topic of health and disease. Yes, you heard it right. So, it is going to be health and disease, right? Now, what is a health? How do you define health? And what is a disease? How do we define disease? Who can clearly tell me like what is health and what is disease? Well, doctors as well as that wherever we are seeing a healthy person, we tell them this person is absolutely healthy without any disease, without any problems. But how can we define the health of a person? So there is an organization whom we call World Health Organization. We are going to study about them also, World Health Organization. So this organization, World Health Organization, today they have given the definition of health. Now what is health? Health is defined as it is the state of complete well-being of physical, mental, social and emotional behavior. So, it is the state of complete well-being of physical, mental, social and emotional behavior, and not just the state of individual free from diseases. Now this is a very big statement. So what does this statement mean? State of complete well-being of physical, mental and social condition. Physical, mental, social and emotional behavior. Now physical condition, we can say any kind of disability, any kind of organ failure, any kind of diseased condition, we can say that is the physical condition. The mental and social, yes, there are nowadays which we see that many of the mental conditions are getting it is getting aggravated. We can see a lot of people suffering from mental problems, various types of mental disorders, trauma, anxiety, stress, many kind of mental conditions are there which we hear nowadays very often. Social and emotional behavior, as we all know, humans are social individuals. Now socially how the person is behaving, whether they are able to interact with another individual or not, that is the social behavior. Emotional behavior is almost related to the mental state, mental condition. So all of these together forms a person healthy. So a healthy person will have the complete state of well-being in their physical, mental, social and emotional condition. And what is disorder mean? Disorder means anything which is deviation from this healthy condition, anything which is a deviation from this normal health condition. It is not just the mere absence of disease, not mere absence of infections. It is the state of complete well-being, and any deviation from the actual well-being is called as the disease. Okay. So here it is the health, but the definition of health which we are stating now, who gave this definition of health? Yes, let's go to the back history of this definition. This definition was given by World Health Organization. So we are going to see what is World Health Organization today. So World Health Organization is an initiative of United Nations at the time of Second World War. At the time of Second World War, when there were many of the outbreaks were there, many of the diseased conditions were there, along with that the war and the health condition throughout the world was very poor. So to enhance the health condition, to elevate the living of the individuals throughout the world, United Nations were created, and at that time this proposal was also kept, like we have to create an organization who is going to look after the each and every individual's health care condition. So based on that, United Nations has created this body which we are now calling as World Health Organization. World Health Organization established in 1948. 7th of April 1948, WHO or World Health Organization is established, and since the day of establishment of World Health Organization is 7th April, so hence we call 7th April, or we established 7th April as the World Health Day. So it is the World Health Day on 7th of April. Alright. So yes, you guys are correct. You guys know it very well. World Health Organization, which regulates the different aspects of the healthcare system in each and every country, is established at 7th of April 1948 by the regulations, by the initiative of United Nations. So now World Health Organization, main question, main important point is that where is the headquarter located? The headquarter is located in Geneva, which is right now in Switzerland. Okay, so it's an European country where the headquarter is located. It is in Geneva. So Geneva in Switzerland is the headquarter of World Health Organization. Now World Health Organization has 6 major regions to look after the world health system throughout the world. For the Americans, for the Europeans, for the Middle East, for the Southeast Asian and African countries, it is having 6 different regions to look after all the various conditions of the health. Now what are the various initiatives World Health Organization has taken? World Health Organization has taken initiative in the eradication of smallpox, in the eradication of polio. Yes, smallpox was a major disease because of which many of the individuals were dying. It had a severe pandemic condition. I hope you remember what is pandemic, what is epidemic, what is another conditions. So now when there were an epidemic, where there were an pandemic situation, World Health Organization had a great role to play. Even same way, the World Health Organization also played an important role in the eradication of polio. Yes, polio virus, you have heard of it. So it is polio virus which was eradicated by the initiative of WHO. Now one more important thing is, WHO has given many of the vaccination strategies as well as now various methods to eradicate the different types of infections. Why we are studying about the WHO? Because WHO is the body which is giving the guidelines for each and every organism, for each and every disease, how to evaluate them, how to diagnose them, when to call it a pandemic, an epidemic or any other condition. So that is why knowledge about WHO is extremely crucial for each and every person who is going to pursue their field in the field of medicine. So whoever is determining, whoever is planning to go for a course in medicine definitely must know about the WHO and its establishment. So this was just a brief introduction about WHO. Now we are going to the types of diseases. So WHO itself has divided the diseases in two formats. Now what are these two formats? These two formats are communicable and non-communicable diseases. So what are these communicable and non-communicable diseases, which we also known as infectious or non-infectious diseases? Communicable, also called as the infectious diseases, and non-communicable, or we can say non-infectious diseases. Non-communicable, also called as non-infectious diseases. So communicable and non-infectious, communicable, infectious, non-communicable, non-infectious. Now what are these things? These are the type of diseases which spreads from one person to another, or a person gets affected by such kind of diseases. So for the classification of diseases, it will be either communicable or non-communicable. The name itself suggests if it is communicable, spreads from one person to another. Spreads from one person to another. That is called as communicable diseases. Spreads from one person to another. Non-communicable diseases do not spread. They do not spread from one person to another. Do not spread from one person to another. So these are the two different forms of diseases, communicable diseases and non-communicable diseases. Okay. So communicable or the infectious diseases spreads from one infected person to another, and non-communicable do not spread. Now what are the different types of examples? What are their processes of communication? Now spreads from one person to another, example like malaria, like common cold. All these are different type of diseases which are communicable. It spreads from one person to another. Whereas on the other hand, non-communicable diseases which do not spread from one person to another, for example, cardiovascular diseases. Can you tell me an example of cardiovascular disease? An example of cardiovascular disease. Who is going to answer me the first? The cardiovascular disease. What is the example of cardiovascular disease? Who is going to answer me first an example of cardiovascular disease? Okay, I'll wait for that. Other than cardiovascular disease, diabetes, another example of non-communicable diseases. Okay, heart stroke, yes, very good. Cardiac arrest, muscle pain, heart attack, very good. So you all know what is a cardiovascular diseases. So cardiovascular diseases, yes, heart stroke, very good everyone. So you all are aware of the terminology called cardiovascular diseases. Now another is the diabetes, hypertension, cancer. All these are considered as non-communicable diseases. Very good guys, very good. I'm so happy that you are understanding and you are aware of the terminologies like cardiovascular diseases. So now we are coming back to these points, communicable and non-communicable diseases. So we are aware what is communicable and what is non-communicable diseases. Let's move on to the next part. What are the communicable diseases? What all agents are there which are acting as the communicable diseases? Alright. So what all agents are there? Agents for communicable diseases. Agents for communicable diseases, or we can call them as pathogen. So these are the pathogen or the agents which are causing the communicable diseases. Now what are these agents? Some of the agents can be, what it can be? Some of the agents such as bacteria, some of them are bacteria, some can be bacterial pathogen, some of them are viruses, we are going to read them too, some of them are fungus, some of them are protozoa, some are helminth, we can call them worms. So these are the various types of pathogens which can cause communicable diseases. Now about that detail you are going to study in your actual classes, but little bit of the knowledge of the organisms which belong to bacteria, which are viruses, that I am going to give you as an overview. Alright. So bacterial, viral, fungal, protozoal and helminthic diseases are different types of communicable or infectious diseases which spreads from one person to another. Now what are the various bacterial agents are there? Bacteria causing the transmission from infected to a healthy person. Which all bacteria transmits like this? For example, the bacteria like Vibrio cholera, you all must have heard of it. Vibrio cholera causing cholera. Cholera bacteria transfers from person to person by many methods, but they are transmitted. Similarly, pneumonia bacteria, that is transmitted from one person to another. Another is the tuberculosis, TB. Tuberculosis caused by bacteria transmits from one person to another. So these are all bacterial agents getting transmitted from one person to another. Now let's move on to the viral agents. About their detail we will study in the actual chapters. That's why I am not going for the details over here. It is just as an overview what all bacterial pathogens you can name. Other bacterial pathogens also you can name. For example, it will be cholera, it will be pneumonia, it will be tuberculosis, it can be gonorrhea, syphilis and many more bacterial pathogens are present. Now let's move on to the viral pathogens. Viral pathogens are like viruses causing the infections. So what all viruses are there which are causing infections? Viruses causing infections such as HIV, human immunodeficiency virus. HIV is there. Other than HIV, you can say hepatitis B, hepatitis C. All these viruses are there which cause infections. Other than hepatitis B and hepatitis C, what else is there? There might be Epstein-Barr virus. There might be chikungunya virus. There might be arboviruses like dengue virus. So these are all viruses. Viruses causing the different types of infections. HIV, hepatitis B, Epstein-Barr virus, dengue, chikungunya virus, all these are different type of viral agents causing infections. Now what are the different types of fungus causing different type of infections? Fungus causing different type of infections are the primary or the most common fungus that we see in our almost day-to-day life, that is ringworm infections. With general words we call it as ringworm infection, but biologically or medically it is called as dermatomycosis. They are called as dermatomycosis. So it is a big term, maybe a difficult name for you to remember, but just break it down. Dermato is skin, mycosis fungal infection. Fungal infection of skin is the ringworm infections. You must have seen it somewhere or the other that at the moist, warm, humid or covered parts of the body some fungal infections appear. These fungal infections are the dermatomycosis. Alright. Other than that, there is candidiasis, another very common infection, candidiasis. Another is fungal meningitis, which inflames the meninges of the brain. Yes, this is a very deadly infection, meningitis. So these are all different types of fungal infections that are seen due to the causative agent like fungus. Now we are moving on to the protozoal infections. What all protozoal infections are there? Protozoa. Protozoa means they are eukaryotic unicellular organisms. So these protozoa will cause severe form of infections in human body. But what are the वो वाला So hello everyone, back again. A little bit of technical errors. So we are back here again. We were discussing about the communicable diseases, and I hope you all have got enough of time for your chatting. So now stop that and let's start studying again. Alright? All these chapters in detail in college. Yes, you are supposed to take admissions. Then we are going to study. We are going to take each and every part of it in detail. Yes. What happened? This happens there. Sometimes some technical glitches are there, some network error, and some many more other unexplainable things are there that happens. So do not worry, we are all here for your easy accessibility as well as for the study programs. So we are now coming back to the topic again. So what we were studying? Communicable diseases. We were studying about the different types of bacteria, viruses, fungus. We have discussed till fungus. So bacterial agents like the tuberculosis, like the Neisseria gonorrhoeae, like the syphilis, like the cholera and the pneumonia. We were discussing about the bacterial agents. We were discussing about the viral agents. What all viral agents are there? Viral agents like HIV, hepatitis B, dengue virus, chikungunya virus, so many more were there. Similarly, various types of fungal agents like candida infections, like the infections of the skin, like the ringworm infections we have seen. And now we are moving on to the protozoal infections. So what are these protozoal infections? We were discussing about the protozoal infections. Protozoa, they are nothing but the unicellular eukaryotic organisms, right? So unicellular eukaryotic organisms, these protozoa, they cause many infections such as the plasmodium. Yes, you all are right. Plasmodium causes, what it causes plasmodium? Plasmodium causes the infection of malaria. Alright, you all must be knowing plasmodium is a protozoa. Protozoa are eukaryotic unicellular organisms belonging to the kingdom Protista. Okay, like the bacteria belongs to the kingdom Monera. Similarly, protozoans belonging to the kingdom Protista. Fungi, kingdom fungi, they are there. And now the protozoal infection, plasmodium, malaria, these are present. Another example will be Entamoeba histolytica. Entamoeba histolytica. This is the full name of the protozoa which causes the condition called amoebiasis. Amoebiasis, or we can also call it in certain conditions amoebic dysentery. So this is a type of condition where excess amount of the stool passage occurs along with blood and the mucus. So that is called as dysentery. And the causative agent of dysentery is a type of protozoa, that is Entamoeba histolytica. So these are the different types of pathogens which are called as protozoal pathogens causing different types of infections. So we have seen bacteria can be a pathogen, viruses can be definitely pathogens, the pathogens like the fungus, the pathogens like the protozoa. Now we are coming to the pathogen which are nothing but the helminth or the worms. Now what are the different types of pathogens? Pathogens like the worms. Pathogens like the worms. Now what are these different types of pathogens like the worms? What are the worms? What we call as the helminth. Who can tell me what all examples of helminth are there? So helminth can be different type of helminthic infections. So helminth or helminthic infections, what are these things? Helminthic infections. So worms. Worms which we commonly called as the different types of worms as roundworms. The most common worm is the roundworm. In the fungal infections, you have seen it is called as the Sorry everyone for this interruption. Very sorry. Yes, I know you all must be in a very good mood to study, but because of all that, maybe a little intermission will be there. So do not worry, we are going to be there for you and we are going to make it all correct. Alright? So yes everyone, come back, start studying again. We were discussing about the different types of communicable diseases. Alright? I hope you all are here. Give me a thumbs up if you all are here right now. Alright? Do not worry, no more interruptions. I am very sure only 10 minutes left. Yes, definitely only 10 minutes left, but we are going to study for 10 minutes and we will continue this topic in the next class also. Do not worry about it. Okay? It will not be a time loss for you. Definitely not. Alright? Yes, thank you Pinky, thank you Varshini, thanks all of you for your support. and thanks for being there for us. Thank you so much, and we are sorry for the interruption. Thank you everyone. So let's start studying again. So communicable diseases, yes, thank you. So communicable diseases, as the causative agents of communicable diseases, there are the bacteria, the pathogen, the bacteria, protozoa, fungus, viruses, the helminth. Right now we are here in the helminthic diseases. So helminth, that always means the worms. So helminths are the worms, and the worms causing the diseases. Likewise, I have told you, bacteria, they are the kingdom Monera. The protozoa, they are the kingdom, definitely the Protista. Fungi, kingdom Fungus, as well as now it is the kingdom which is in Animalia, we are call it as the worms. It belongs to the phylum Nematode. They are the nematode organisms. So they are the phylum Nematoda. Now these worms are of various types. These worms cause different type of infections. Different type of infections in our intestine, different type of infections in the various parts of the body, in the muscles, in the tissues, as well as even in the brain also. So these pathogens, these worms, they are going to be there. So what are the different types of worms we were discussing? The different type of worms such as the roundworm infections. These roundworm infection causes the intestinal infections. So they are intestinal parasite. Intestinal parasites they are intestinal parasites. Similarly, filarial worm which causes the elephantiasis. Again, detail I am not going for this because you have to study them in great detail. So filarial worm is a condition which is the elephantiasis is caused by this. So filarial worm or the worm which causes elephantiasis stays in the lymphatic vessels. They stays in our lymphatic system. So these are the tissue parasite. They are living in the tissues, they are living in the lymphatic vessels. So they are tissue parasites. Another one, for example, Taenia, or we can call them as Taenia solium, Taenia saginata, many types are there. So they are called as the tapeworms. Even they can roam around at a different places in our body, starting from the intestine to the muscles and various parts, including the brain. So these are the different types of the worms which belonging to the phylum Nematode of animal kingdom. They cause infections in our body. They are the parasites present in the body in the form of different conditions in the liver, maybe in the muscles, maybe in the brain or in the intestine. So they are present at different parts of the body and cause infections. So these are the different types of helminthic infections. So we have studied today, we have seen the bacterial pathogen, the viral pathogen, the protozoa and helminth pathogen and the fungal pathogens. So these are different pathogens which cause different type of infections in the body. Okay. So next, what is it? The mode of transmission of the infections. How these infections are being transmitted. See, overall a chart I have shown here. So what are the various different methods of transmission? Different methods of transmission. First of all, it is the coughing and sneezing, the fecal matter, the blood and the fluid. Okay, let's have a brief look at it. So now first it is the modes of transmission. Okay, so now modes of transmission, again a very important point, a very important topic, but we don't know what all different methods of transmission are there for these pathogens or for these infections. So different infective agents like bacteria, like the viruses, they use different methods of transmission. Now what are the different methods of transmission? First of all, different method of transmission is through blood and is called as blood-borne diseases. Alright, through blood if it is transmitted, these are the blood-borne diseases. Similarly, another method is called as feco-oral transmission. Another is called as different type of fluids, and different type of fluids we can call it body fluids. We can call this as body fluids. Through sneezing and coughing it is called as aerosol, and vector-borne diseases. So blood and blood-borne diseases, feco-oral transmission through fluid transmission, as well as aerosol and vector-borne diseases. Now this is all about the communicable diseases we are discussing now. So communicable diseases that communicates or spreads from one person to another. Alright. So from one person to another, if it is spreading, what are the different ways that it goes from one infected person? Hello guys, sorry again for that. Actually there is some major technical issues going on and we are trying to resolve it. For that purpose today's zoology class will not be completed, and definitely I promise you that this class will definitely I'll be taking tomorrow. Okay, right from the place we have started facing the problems and the interference. Okay, so I wish you all will support us, will always be there for us and will understand the problem. It is a major technical glitch because of which we are not able to conduct it right now. Okay, so it's almost the time and I'm going to see you all tomorrow with the same class, with the same topic. We will be studying it ahead. Okay, so stay tuned everyone tomorrow. Thanks for understanding and goodbye to you all.